This is KMTV 3 News Now, live at 6.
Nearly half of all COVID-19 deaths in Nebraska are people who lived in long-term care facilities. Our investigative team dug into state inspection records and found 4 facilities in Nebraska where the state handed out the worst possible letter grade for failing to control the virus. One facility cited for failing to follow infection control procedures was cited in 9 other areas as well. Not sure we have anything written on COVID-19 policies. I don't know. I just got here today. I don't know if I should be here right now. These are just some of the things employees at Continental Springs in South Sioux City said to an inspector in May when the facility was dealing with an outbreak. Overall, the facility was hit with citations for 10 different areas. 2 of them, infection control and quality of care, were put at an immediate jeopardy level.
The number one thing that you can do to keep COVID-19 out of your building and keep your residents safe, do not work when you are sick.
The CDC released videos like this of what long-term care facilities needed to do during an outbreak weeks before inspectors visited the facility. But inspection records say on at least 14 different occasions, employees wrote they had COVID symptoms when screened and were still allowed to work. In fact, during an interview with the inspector, the director of nursing said, "I currently have symptoms and don't know if I should be here right now." On top of that, some of the rooms of residents who were supposed to be isolated were not marked to the point some staff didn't know who was under isolation. This included a resident on isolation precautions who had no sign on the door and no curtain between them and their roommate. Records show the administrator of the facility told the inspector they were not sure if they had written COVID-19 policies, but they were, quote, always talking about it. In addition to issues with communication, they lacked staff. When asked about a resident who had not had a bath in 24 days, the director of nursing said they didn't have enough staff, and neither did staffing agencies.
The snapshot that we had in December of facilities in Nebraska reporting to CMS was that 43% of the facilities in the state reported staffing shortages.
Todd Stubendek of Nebraska AARP said many of the problems nursing homes face were here well before the pandemic hit.
There's a GAO report that showed 80% of facilities nationwide were cited for infection control issues in their annual inspection by the state before COVID.
In 2019, DHHS wrote up Continental Springs for several deficiencies, including potential cross-contamination.
I hope we take what we've learned in infection prevention and really ramp up our training and the approaches that we take.
Heath Bodie with the Nebraska Healthcare Association says he's helped several nursing homes deal with outbreaks, but he didn't recall Continental Springs.
Do you think any of these deaths could have been prevented?
I don't know of a situation of a provider that didn't try to take the information that we had at the time and do the very best they could to serve the elders in their care. 14
residents died from coronavirus in 2020, according to Continental Springs. At the time of the May inspection, 53 people lived there. Continental Springs denied our request for an interview. The current administrator and director of nursing did not work for the facility during the inspection.
It's heartbreaking. And again, the plea we've made is that these are our mothers and fathers and grandparents and neighbors, and we need to be doing everything that we can to protect them. They truly are our most vulnerable citizens.
A letter from the state to the South Sioux City facility says Continental Springs failed to monitor and intervene with 2 diabetic residents who had changes in condition. Both died. You can see the whole inspection on our website, but this is just one of more severe inspection reports we've found so far in Nebraska, and we've filed another records request to get more inspection records. We know of 62 more inspections in Nebraska that found inadequate infection control last spring and summer. We also know of 157 inspections that included infection control that found no issues. We also put together a database on Nebraska nursing homes where you can look up a facility by name or town. It's on our website, 3newsnow.com. The facilities that were cited will list a letter grade for how severe the finding was, and you'll be able to easily find a link where you can read details on an inspection. And if you know of a nursing home that we should look into, please email us at investigate@3newsnow.com.